families, this is Nurse Gage. We are so excited to think about returning face-to-face and to finally get to see your children in person. Your Ann Arbor Public School nurse team has been busy working, and we are ready to share some details about pre-screening your child for illness in the morning and when to keep your child home from school. Each morning, it will be important for you to check your child and to ask these questions to make sure they are well before leaving the house. Number 1, in the past 24 hours, has your student experienced any of the following new or unexpected symptoms? Fever of 100.4 or higher, or feeling feverish, like chills and sweating. New cough, difficulty breathing, sore throat, vomiting or diarrhea, new loss of taste or smell, new onset of severe headache, especially with a fever. For children with asthma, this would be a change in their baseline cough or breathing. If your child is experiencing any of these symptoms or is not feeling well, we ask that you please keep your child home from school, isolate, and contact your healthcare provider for further guidance. We also want you to consider whether or not your child has had any recent exposure to COVID-19. Number 2, in the past week, has anyone in your household been diagnosed with COVID-19? In the past week, has your child been in close contact with anyone outside the home who has a confirmed or probable case of COVID-19? Is your student under evaluation for COVID-19? If you answer yes to any of the exposure questions, please keep your child home from school, quarantine, and contact your healthcare provider for further guidance. Your school nurse or a member of our COVID-19 response team will be available to take your questions and help direct you on to the next steps. Let's work through a few scenarios of whether you should send your child to school. Your child has chronic allergies and wakes up with a runny nose and a cough. What should you do? Let's look at the whole picture. Does your child have other symptoms? Is anybody else sick at home? Was there an exposure to COVID-19? Is this what your child's symptoms look like when their allergies flare? Should you send your child to school? Green light. As long as this aligns with your child's typical allergy presentation, they have no other symptoms and have not been exposed to COVID-19 or sick family members, your child may come to school. Children can experience a variety of allergies, such as seasonal, environmental, and pet. And symptoms might include red or itchy eyes, sneezing, clear nasal drainage, congestion, and a dry, irritable cough. Many of these symptoms can be similar to COVID-19 symptoms, so it's important to look at the whole child and focus on their usual presentation. Make sure your child's allergies are updated in InfoSnap, or if you communicated this information with your school nurse. Your child who has chronic allergies wakes up with a runny nose and cough. Their sibling has a fever and a cough. What should you do? Red light. Although your child is experiencing their typical allergy symptoms, they've been exposed to a sick family member and should stay home from school. Contact your healthcare provider for further guidance. Your child wakes up and tells you their stomach is hurting. What should you do? Let's look at the whole picture. Does your child have other symptoms? Is anybody else sick at home? Was there an exposure to COVID-19? Is this typical for your child? Green light. Your child's temperature is normal and they have no other symptoms, no one else in the household is sick, and your child feels better after eating breakfast. Your child can come to school. It's always good to double check for other symptoms. Stomach aches may be caused by worry about returning to school, constipation, or hunger. Your child wakes up in the middle of the night and feels warm. You check their temperature and it's 100.4. You give your child a dose of ibuprofen. When you wake them for school, they no longer have a fever. What should you do? Let's look at the whole picture. Does your child have any other symptoms? Is anybody else sick at home? Was there an exposure to COVID-19? Is this typical for your child? Red light. Your child had a fever. There are 2 points to consider. A fever that's been treated with medicine indicates that your body is fighting off an infection. Your child should stay home from school. Even though they feel well in the morning, your child must be fever-free for 24 hours without fever-reducing medications, per Ann Arbor Public Schools illness policy. Remember to check in on each of your children every morning to make sure they are feeling well, and please keep them home if they're sick. You know your child best, but in this COVID-19 era, we must look at the whole picture and add an extra dose of caution. We are so excited to see you back in the classroom. Let's have a healthy return to school.